we are inducting one honorary member, Miss Gibbie Harris, RN, MSPH, is the Health Director of Mecklenburg County. In this role, she manages, provides vision, and directs all public health and environmental health activity in Mecklenburg County. Ms. Harris earned her BSN and later her MSPH in Health Policy and Management from UNC Chapel Hill. Early on, she was challenged by the emerging HIV/AIDS epidemic. Her strategy of building community partnerships using analytics and open dialogue set the tone for her successful career. Prior to joining Mecklenburg County in 2017, Ms. Harris's 25-year public health career had included positions as health director for Wake and Buncombe counties. Along the way, she had managed the transitions of single county health departments into consolidated health and human services agencies. Her administrative excellence was recognized. In 2011, Ms. Harris was named North Carolina's Health Director of the Year. For the past 15 months, Ms. Harris has drawn on those experiences in ways she has never imagined. As the public face of Mecklenburg's pandemic response, she has provided brief, evidence-based, non-partisan guidance and a calming voice amid an ever-changing pandemic landscape. Congratulations, Ms. Harris. Welcome to share your experiences with us.
Good evening, everyone, and thank you so much for having me here tonight. I want to thank Dr. Warren, Dr. Thompson, as well as Dr. Platanova, I'm going to say your name wrong, for this honor. It truly is an honor that to be accepted into this, this group and to be part of both the alumni as well as the new inductees that I've heard about tonight. Such an incredible group of young people. Congratulations to all of you, and I really look forward to see what you accomplish over the next years as you move forward. So, you know, one of the things they've asked me to talk a little bit about the Building Bridges to Better Population Health and some of the things that I've learned over the years. And I guess, you know, I listened to Michael. I shouldn't have gone after him because we both think a lot alike in terms of some of the things that we think are most important. But a couple of things that I will say is, you know, as you know, I am a nurse. I started as a nurse. I worked in a hospital for a couple of years, decided that was not my cup of tea. I went back and became a nurse practitioner. I ran a rural health clinic for a couple of years, enjoyed that and being more involved in the community, but then had an opportunity to start a hospice program in North Carolina. Started the hospice program and ran that for 8 years. Actually, I was the first employee, so I did a little bit of everything. And so there was a lot of home visiting, a lot of opportunity to work with families, not just individual patients, a lot of opportunity to see all of the different issues that impact families and how that influences their health and the way that they respond to their health and to their community in general. And actually ended up being the director of that organization. We built the first freestanding inpatient facility in the state and realized at one point that I was sort of managing by the seat of my pants. I really did not have a lot of education in management and thought that it might be helpful if I learned a little bit more about that. The other thing that drove that is we had our first HIV patient. And this young man died a couple of weeks after he came back from New York, where he had become HIV positive. He came home to die with his family. And I realized I was tired of seeing people die from diseases that were preventable. And so public health just seemed like a good fit for me. It helped me with the whole administrative management side, but also the policy side, as well as the prevention side of disease. And so I got into public health, and, you know, so I came at it in a much slower way than most of you have. And it has been my passion ever since. I want to mention the fact that I understand that access to healthcare, good healthcare for everyone, is critical to the health of our population. But I also want to recognize that public health is a system. Hospitals, healthcare is part of that system, but it is only part of that system. And all of the other things that impact health have to be part of that system, and it has to be tied together in a way that provides the support for our families and all of those individuals in our community to make sure that they are able to be as healthy as they can be. That's how they're going to be productive. That's how they're going to be able to raise their children. They need to be able to get the education they need. All of those things impact their health. So for me, I'm going to put a shameless plug for public health in here. Local public health is sort of the hub of that public health system. And if that hasn't been apparent over the past 15 months, it's never going to be apparent. As public health has been involved in the implementation of all the different responses to COVID. But I've got to tell you, I'm also involved in the issues around employment and the issues of how we get people back into work and how we make sure that our children get back into school, and the fact that people don't have the transportation they need. So it's just a big picture that we in public health have to continue to keep in our minds. And the other part of that is the whole issue of health equity has to be a lay over all of that if we're going to be successful in helping our communities be effective for everyone in our community. So I recognize that most of y'all are looking at hospital systems to work in, and I appreciate that and I applaud that. But as you can see, I started in healthcare and sort of moved into the local public health arena. I actually worked at the state for a couple of years in HIV in the early days, and recognized fairly quickly that I preferred working in the community. Number one, back in those days, I couldn't get much done around HIV because of the politics of it, and came back to the local level to work. So, you know, I just want you to think of the work that you're doing, and several, especially of the alumni, talked about the impact of the other things in the community on the people that they're serving and what they're sending people back to when they leave their hospital systems. And think about how you can affect that, whether you're working in a hospital system or whether you're working in the community itself. One thing that I will recommend to you as you move into your careers is, regardless of where you work, that you find opportunities to work in your community on the ground. There is nothing more educational than being boots on the ground and working with the community. You need to be a leader, but you also, part of being a leader is being willing to be led. And quite often being led by your community is what's going to help you understand what they need. And we have a bad habit, have had for years, of thinking that we know what our communities need and telling them, giving them what we think they need. The reality is, and I learned this at the knee of Lucille Webb in Wake County, an African-American woman who had been a teacher and was doing community work, who took me by the hand and said, "You're screwing up. You need to pay attention to the community. You need to listen to what they're saying to you, and you need to give them what they need before they can hear what you think they need." So all of those things have been learnings for me and have served me well as I've attempted to work in the community. A couple of other points that I'll make, just from what I have learned and what may be helpful to you as you move forward. Number one, always learn. You're never too old to learn. I learn new things from my staff, from my community, from many people every day. And so that is critically important. And the other part is be ethical and honest. never hesitate to say, I don't know, and just be as honest as you can be. Trust is, there's nothing more important than trust. Michael mentioned that as well. If we don't have trust with the people that we work for and with, then we can't be effective in the work that we do. The other thing that I will say is be willing to take chances. You know, I started out as a nurse. I was going to be a nurse my entire life. I came from a healthcare family, knew that that's what I was going to do. And I listened to my heart. It was not what I wanted to do, to be a nurse in a hospital, not long-term. And so be willing to take those chances, because it opens up new opportunities to you that you may not have thought of as something that you'd be interested to do. And get comfortable with change, folks. If you're not comfortable with change, you're going to be miserable, because that is one of they talk about death and taxes. Well, change is one of those things that's inevitable as well. And so just get comfortable with it and learn how to adapt to change and help the people around you adapt to change. The other thing that I will say, the couple of last things, just learnings that have been important to me. I mean, there are books and articles about leadership roles and what's important in leadership. And I'm not going to try to list all the different things that the people who have studied leadership say. The things that have been important to me is to be true to my values, know what they are, and be true to them in the work that I do. Be engaged in your profession. You need to give back. When you have the opportunity to work with a student or with someone else to help them grow in their profession, make sure that you're doing that. Self-care is critical. You need to take care of yourself. You can't take care of other people if you're not taking care of yourself. If we haven't learned that through COVID, we're not going to. I have had to push my staff, who are so passionate about their work, that they won't take a day off because they're afraid something's going to go wrong, and nobody's indispensable. You need to take care of yourself. And lastly, if you don't do anything else, keep your sense of humor. That is critical to life in general. So be willing to laugh at yourself. I do that almost on a daily basis because I have a bad habit of doing something like muting myself when I'm not supposed to, or something else. Be willing to laugh at yourself, but also keep that sense of humor with others that you work with and that you play with and that you work for, because that sense of humor will help you get through the day. So I have talked enough. I am very grateful again for this recognition. The point that I try to make is that whether you work in the healthcare system or in public health or wherever you work, it's a team effort. You don't work by yourself, you work with others. And so I accept this award, but I accept it on the behalf of all the people in my department that I've worked with and all of the people in public health that I work with, because they're all champions as far as I'm concerned.